Hi everyone. Um, it's 10:01, so we'll just get started right away. Welcome to our Brown Bag, November 8th. This is for National Diabetes Awareness Month. As you may know, we're doing two this month um, to honor National Diabetes Awareness Month. This one is stigma and mental health. And if you're not familiar with DPAC, we work both with patients and with legislators. So we train patients on how to best tell their stories to legislators and advocate for themselves. And then we also, on the legislator side, educate them on the needs of patients and help to facilitate that communication. So we have two amazing speakers today. I'm actually going to stop sharing my screen so that you can see them. Hold on. Yay, okay. So we have Matthew Garza. He's the director of the dStigmatize program at the DiaTribe Foundation. His work focuses on addressing the pervasive issue of diabetes stigma and discrimination, and he currently lives in San Francisco. And then we have Dr. Mark Heyman. He is a diabetes psychologist and a certified diabetes care and education specialist. He's a CEO of Center of Diabetes and Mental Health in San Diego. So all three of us are in California for once. And he's also the host of the Live Free with T1D podcast and the author of Diabetes Sucks and You Can Handle It, Your Guide to Managing the Emotional Challenges of T1D. So welcome. Thank you so much for joining us today and happy National Diabetes Awareness Month.
Thank you for
Thank you
having
for
us.
having us.
Yeah. So as I mentioned, it is National Diabetes Awareness Month, and we're here to talk about stigma and mental health. So could you please introduce yourselves and your relationship to diabetes and what attracts you to diabetes mental health advocacy?
Sure, I can take it first. So, hi everyone, my name is Matthew Garza. As Amanda said, I am the dStigmatize director at the DiaTribe Foundation. So we're a nonprofit focused on education and advocacy for people with diabetes. While I don't personally live with diabetes myself, I've grown up my whole life surrounded by diabetes management, diabetes care. My grandma has type 2 diabetes, as well as my dad and my uncle. So it's something that has always existed in my life, and just been something that has always been a very natural part of the day-to-day. The way I ended up in diabetes was definitely a bit of an accident, but I can't tell you how happy I am that I landed in this wonderful field and getting to work with such amazing people who are just trying to make the world better for those living with diabetes and their loved ones. So yeah, thank you for having me here.
Yeah, of course. How was it an accident?
Yeah. Well, I was planning on going off and becoming a doctor. And so I had finished my undergraduate schooling, and I was trying to figure out, what I would do during my gap year before I started applying to medical school. And there was a program that Kelly Close, the founder of DiaTribe, had called the Associate Program, where, future doctors, future graduate students could come and work at one of the kind of family of close concerns organizations for 2 years. And at the time, my diabetes kind of experience had been very much like lived experience of being surrounded by those who have it, but never actually working in the field. But I was able to get a job as one of the associates at DiaTribe. Was planning on just being there for 2 years, but I ended up loving it so much, loving the advocacy, the educational pieces, just getting to work in the nonprofit space, that I've stuck around a lot longer than the 2 years that I was planning on it.
That's amazing. Yeah. And fun fact, Matthew Garza and I went to undergrad together and didn't know each other. We're the same year and it's not a big school, but we somehow just did not know each other.
It was
Um,
very funny how that works. Yeah, we were both there at Johns Hopkins over in Baltimore, which also is just they do such amazing work in diabetes there, and just the fact that, yeah, like we just never ran into each other, never even knew it. But it's been so great to be able to connect with you after the fact.
yeah, yeah. I looked you up on Instagram and we had like a billion mutual friends and I just had never seen you in my life.
Yep.
Yeah. Well, okay, so thank you, and we will get back to you about the work that you do at DiaTribe. Mark, you're known as the diabetes psychologist. Tell us a bit about the work you do and how you help people living with diabetes.
Yeah, absolutely. So, excuse me, I was diagnosed with type 1 diabetes in 1999. I was a third year college student. And, when that happened, it hit me out of the blue and I was just struggling to kind of make sense of what that meant. And I looked for lots of resources or I looked for resources, any kind of resources that could help me deal with the transition, the acceptance, the burnout, the anxiety, everything that was happening for me. And I couldn't find any. And so long story short, I decided to become the resource that I wish that I had when I was diagnosed. And so I went to graduate school, got a PhD in psychology and health psychology, and kind of through a kind of a circuitous route I ended up working specifically in the world of diabetes. So I do a variety of things, and really my mission is to make sure that people with type 1 diabetes have the mental health support that they need in the way that they need it whenever they need it. And so while I do have a small therapy practice where I see folks with type 1 diabetes, my goal is to really provide a continuum of care. And what I mean by that is anything from an Instagram or LinkedIn post that can give somebody motivation, education, tools and support, to podcast, to my book, to digital programs, and then certainly we have one-on-one coaching and therapy that we offer within my ecosystem. But it's my belief that everyone with type 1 diabetes needs something, but very few people actually need one-on-one therapy, and that we can give people the support they need in a variety of ways, in ways that are accessible to them and affordable to them. And that's really what I do, and my vision for the world of diabetes while we have it right now.
Thank you. That's amazing. Yeah, we would love to also share some of the resources you have on your page after the fact. Matthew, tell us about the Spoonful of Laughter campaign, what it is and what its goals are.
Yeah, definitely. So like I mentioned, I run our dStigmatize program at DiaTribe. And in that program, we have lots of initiatives. We have things focused on research. We have things focused on education, especially education for healthcare professionals. But we knew that whenever we wanted to take on a problem that is as big as addressing diabetes stigma, you've got to come at it a lot of different ways. And one of the ways is to try and address the narratives that are very persistent in our culture currently about what diabetes is, what it looks like, and how it affects people. Right now, those narratives are filled with a lot of misinformation, a lot of myths, stereotypes, and a lot of stigma. And in order to kind of, reduce those narratives, you have to replace them with something else. So we came up with this idea for Spoonful of Laughter, which is a comedy campaign where we partnered with comedians who have diabetes and those who don't to come up with a series of short videos that include stand-up clips, sketch comedy, even some comedy that looks a little bit more like a sitcom, basically to educate about diabetes and push back against stereotypes and stigma, but in a way that was entertaining and funny. And the whole goal of this campaign was that we knew we didn't want to just lecture people into changing their stigmatizing behavior or to try to, lecture people into building community. We wanted to lead them kind of like laughing into a better world. We wanted to entertain people, to make sure that people remembered what they were watching, remembered the educational pieces and the messages, while also just like letting them, take a break from the stress and the frustration that comes with something as challenging as diabetes, and hopefully just kind of laugh at it. So, we launched a Spoonful of Laughter on Instagram. That's our account there, as well as spoonfuloflaughter.org, where you can see all of these videos and everything. And definitely we'll have some more to say about that. But yeah, it's been such an amazing campaign to be a part of. And I think the best part of this is just seeing the reaction, seeing so many people with diabetes who say, I've never seen diabetes represented like this. This is so authentic. This is so, shedding light on my exact experiences. And it's a way to kind of like reach across to those who don't have diabetes and introduce them to something that looks a lot different than probably what they've seen before.
Yeah, I think on that note, it's easier to send a funny reel to your friend as opposed to sending them an infographic explaining, like lecturing them. So that's a really great way to kind of, for people with diabetes, to help people who don't have diabetes understand the experience without coming off, patronizing. So we know that there's a lot of stigma between the type 1 and type 2 communities. In advocacy, we are all better together and we all want the same things: increased access, lower prices, better care, less stigma. And on top of that, we're definitely more effective as 38 million people rather than the small percentage of us that's just type 1, as we advocate for the needs of the diabetes community. But can you tell us a little bit about the stigma that you have seen between type 1 and type 2 communities?
Yeah, I can definitely kind of take a first pass at this. And Mark, I'd love to hear what else you have to add as well. I think one of the things that we see very often is that there is this kind of unintentional tension sometimes within the diabetes community. And a lot of this has to do with the fact that the stereotypes and the kind of judgment that is often passed on those who are living with diabetes come from a lot of times the misinformation that all diabetes is the same and that diabetes is a result of poor choices or personal choices. And so the fact that you now have this chronic condition is your fault or it's your responsibility to take care of. And that's not true. It's not true for those who live with type 1 diabetes, and it's not true for those who live with type 2 diabetes. But especially we think, whenever people are confronted with that stigma or those judgments, it's a very common and understandable defense mechanism to push back against that by trying to shift the blame somewhere else. So, someone with type 1 might say, well, I got diabetes as a child. This wasn't my fault. This, wasn't my choice. That's something that has to do with type 2 diabetes. And I think that there's a lot of, there's decent intentions behind that. But what we see is that what it does is it reinforces the stereotype. It doesn't actually correct what that person is thinking or shed new light. It just says, oh no, your stereotype is right, but that's for that other group of people, not for me. And so what we want to do is showcase that there is a way to educate about how the different types of diabetes are different. Type 1s don't have access to all of the, drugs and other kind of medications that type 2s have. They show up differently in the body. They might have different symptoms or signs at the very beginning. But ultimately, we can do that education without pointing blame to someone else. And when we're advocating for things that everyone with diabetes needs, right? Increased access to care and education, lower prices, better care. That's something that everyone needs, not even just those who have diabetes. And so when we start to pull together the community a little bit, I think we can see that there's a lot more success.
Yeah, and I think that one of the places where, from the type 1 community, where the stigma and the challenge comes in is that, people with type 1, especially, at least in my world, they want to feel understood. And the lived experience of living with type 1 is very, very different than the lived experience for most people living with type 2. And so that's where, and so when I think that when diabetes is grouped together, there's a defensiveness on the part of the type 1 community that it's not, and it comes out in a way that it can be negative and stigmatizing, and oftentimes it is. But we each want to be seen as individuals dealing with our own with the challenges. I did a poll on my Instagram several months ago asking people with type 1 diabetes, who's my primary audience, how important is it that your healthcare provider or your mental health provider understands and actually lives with type 1 diabetes. And 99% of people of over 100 responses said it's extremely important, which was shocking to me. But that really hones on the point that, it's important that the lived experience is important to really understand and to be seen. And so when type 2 diabetes is grouped in there, there's a perception that we are not being seen. Now, I think there's lots of education. I love what you say, Matthew, about providing education about the differences because they are different, and we have to recognize that. But at the same time, we can certainly work together to be understood, to advocate for ourselves, and to get the resources that we need.
Yeah.
Yeah, both of you, that was so eloquent. Thank you for saying that. I know all people with type 1 have seen a lot of, once we tell people we have type 1, there's different reactions from people. Sometimes people, reinforce some very harmful stereotypes. Sometimes people, you kind of have to jump in and volunteer like, oh, even if I had type 2, like that's not necessarily my fault either. And I think Zinnia in our comments, she was actually on a brown bag recently too. She was saying she's left multiple online diabetes support groups on Instagram and Facebook because of cruel comments about type 2 diabetes. And I think it's definitely some level of like internalized stigma too, where we are constantly being, stereotyped as a community. So next question, sorry. We try to fight stigma as a community, but it permeates us from the inside as well, not just type 1 versus type 2, but within each of these communities as well. Stigma permeates at every level. Our role as advocates with DPAC is to educate lawmakers on the needs of our community, and knowing what we know about how pervasive stigma can be, how can we approach this kind of thing in conversations with lawmakers?
I think this one is definitely a challenging one. And I think part of it is that, one of the things that I always come back to, especially because of a lot of the work that we do kind of on the research side of things with dStigmatize, is there was an international consensus statement published a few years back around obesity stigma and weight stigma. And one of the kind of key takeaways and recommendations that they came up with was this idea that because there's very few policy or legal protections for people who may have overweight or obesity, that kind of signals to the rest of us in society that this is not something we need to care about, or this is not something that's that important. Weight stigma isn't a problem because if it was, there would be policies to protect it. I think that even though there are some protections for people with diabetes, things under the Americans with Disabilities Act and that sort of thing, a lot of times they're not well known, they're not as understood, especially by the diabetes community. And the rest of the world doesn't really know anything about it. And so it's that same kind of problem where we think that this isn't an issue because there's no signal to us that it should be considered an issue. And so one of the things that we always try to do, especially when you're talking to, or maybe talking to, legislators or people who work in policy, is this idea that you might have to educate first. You may have to teach a little bit about what diabetes is first. I think that it's important that when you're doing that, you take the strategy of, sure, facts, research, all of that is very important. Stories, your personal experience, your anecdotes, the way that you navigate life is equally as important. And when we match the data with these lived experiences, a lot of times we can see that it has a really persuasive effect on people. And it goes a lot further in helping people remember what you're saying, remember the why that you're saying it, and kind of tug on the heartstrings in a way that allows that data to actually kind of come through and then make it so that this is an issue that people want to care about.
Yeah,
Yeah, and I think that in that process, storytelling is extremely important as a way of showing the differences and showing the real needs of people with diabetes and the struggles that they have from a point of view of not stigmatizing them and also not placing blame. I think the challenges that we come across with talking about diabetes in general, and also a lot of the misperceptions, is that people, especially with type 2 diabetes, which then oftentimes translates to a perception of all people with diabetes have made choices, then it's their fault, so why should we care? And the reality is that's simply just not the case for type 1 or type 2 diabetes. And so providing that education and information, but in a way that's understandable and in a way that's relatable. And I think that storytelling and talking about people's experiences and then using data to back that up is a really effective tool for talking to legislators.
Mm-hmm.
Yeah, I think as people with diabetes, we already are talking to people on a daily basis about our needs, just going about our everyday life. And I feel like something we try to emphasize is that talking to your legislator is not so different from talking like to your doctor. If anything, it's kind of less scary because your doctor, sometimes you have to directly challenge them on what they know. But your legislator doesn't have necessarily a medical expertise. So it's a little bit easier in that sense to approach it as an authority on the subject. But it's very similar to like being in your doctor's office and saying, oh, no, actually this thing works for me, or no, this is my preferred method of care. And so that's something that it's kind of just translatable across all different audiences.
And I was going to add, if I could, just one other thing, which is that the burden doesn't have to only fall on the diabetes community to advocate, especially at the policy level, for better protections or better rights, or even just an understanding and awareness of something like stigma. I cannot imagine, as someone who doesn't live with diabetes, how hard it is to have to explain a chronic condition that already demands so much from you to every person you meet. That's got to be exhausting. And I think that there's a lot more that those of us who have loved ones, those of us who work in the diabetes field, those of us who just live in America, where the odds are you probably know someone who lives with either type 1 or type 2 diabetes. There's a lot more that we can be doing to make sure that, you know, people with diabetes are always at the table, always have the microphone to speak, but that we are helping to amplify and elevate those asks, those advocates, and make sure that they're not doing this just on their own.
Yeah, for sure. A lot of our advocates actually are the most fierce advocates are like the parents or children of people who have diabetes or the spouses. So we find that that's really effective for an outside perspective, because if you're the third party, you're talking to another third party, and it kind of there's a connection on that level. Like I see this from them. So yeah. And so as a policy organization, we like to stress that talking to your legislator, I already said this, about your diabetes needs isn't too different from advocating for yourself with the people you encounter every day. So what are some ways that we as individuals can lift the diabetes community up?
From the point of view of the people that we're working with or talking to every day in our daily lives?
Yes, like the way that it translates to our everyday lives, as opposed to, you don't have to be talking to your legislator, just in general.
Yeah, sorry, go ahead, Matthew. I come back to the idea of storytelling, being able to talk about, you know, your experience with diabetes and how it shaped your life, both positively and, oh, sorry, both negatively as well as positively. You know, I really, I try to help people to see that, of course, I have diabetes. I would give it away in a heartbeat. I mean, I don't fundamentally want to have diabetes. However, in my experience, it has also helped me to grow so much in my professional life. Certainly, it's given me a career, but also in my personal life, and really kind of helping people to see all of the aspects of diabetes and how it has impacted and influenced who you are. And that includes the daily management tasks. That includes the anxiety and the worry that you're dealing with on a regular basis. But it also includes your ability to be, you know, maybe an advocate for yourself, a communicator, and really to show that whole picture. And through that, we're able to see, you know, what the lived experience is. Because again, back to we want to be understood by people in our lives. And also on that note, I want to be clear that I think that sometimes it's not relevant. And explaining yourself or explaining diabetes is not helpful for your own mental health, and it's not helpful for anybody else in your life. And so to feel like you always have to be on and always explaining, you ought to be careful there, because certainly there are some times in your life and with some people that it's important. But when you're, you know, living your daily life, it's not, it may not be important, and you have to pay attention to that as a function of, you know, how much do you want to be thinking about it and thinking about the perception that's coming on you all the time. And oftentimes that's a boundary that you want to set and say, no, thank you.
Yeah, I completely agree with that, Mark. And the thing that I would add to this as well, I think, is when we're thinking about like how do you lift each other up and all of that, I think that it is a tendency sometimes to promote the superheroes, the ones who are going above and beyond, as kind of a great example or a positive example of like, people with diabetes can do everything that anyone else can do. And look at this person who climbed Mount Everest, or this person who, you know, sailed around the world. And those people are superheroes, and it's okay to celebrate and talk about those things. And I think that it's also okay to celebrate the little wins, the everyday activities, the fact that you as a person with diabetes is able to get through another day and are just living your life the way that you hopefully want to be living it as best as you can. I think the more that we celebrate these kind of like everyday acts of heroism are just as important. And it helps to kind of make it so that you don't always feel like, if I'm not achieving, you know, the perfect example, that I'm not good enough, or I'm not doing enough, or I'm not a good diabetic, or any of those things. Like, just living your life is good enough, if not better. And I think the more that we can support each other, and those of us without diabetes can support those living with diabetes to celebrate even those little wins, it can definitely be a way to kind of just shift the framing a little bit, so that it's not always a focus on the bad or on what you haven't done. But, you know, walking up the hill to your house after a run to the grocery store is just as good as climbing Mount Everest some days, if not better.
Yeah, thank you for saying that. I really appreciate that as a person with diabetes myself. It's definitely a thing to like, comparing yourself to the superheroes, not just in diabetes, but in general, honestly. And yeah, it really is enough just to be here, and you can't give 100% every day. Like some days your best is 50%. And if you're giving 50%, then you're giving your 100%. So I really appreciate that.
Yeah.
So you've both been working in the diabetes space for a while now. What are some recent signs of progress you've seen when it comes to stigma, rhetoric, and mental health? And what are some areas that still might need some improvement?
Yeah, so and I have been so pleasantly surprised over the past, I don't know, 5 or 6 years, I'll call it, where mental health is talked about so much more. It felt like when I was diagnosed with diabetes, it wasn't talked about at all, or very, very little. When I first started doing this work, it was I was kind of the I was the outsider of like trying to bang this drum. When people talked about it, there's a lot of stigma about, you're dealing with burnout, like, you're not, you need to be doing better. And now the fact that we're just having conversations about it, like we are how right now, that if you go on social media, people are talking about their mental health all the time. A lot of endocrinologists and certified diabetes care education specialists are really focusing on the emotional aspects, and having those conversations. We have a lot more to do there, but just the fact that we are having the conversations more openly right now, and people are talking about it and learning about it from the point of diagnosis on is phenomenal. I think one of the things, and another thing that I'll say is that um, over the past couple of years, I've seen a big shift in how people think about their diabetes technology and their devices. For a long time, there was a group of people who were very, and I'm not really sure how to characterize them, but they were very resistant to using CGM and insulin pumps, for lots of reasons. But the biggest one was because they believed that it was a physical reminder of their invisible condition, and that it would draw attention to them from the outside that they didn't want. And I think that this was like kind of a happy accident, but thanks to people now biohacking with the Aura Ring and with the Dexcom Stello and all these other technologies that people are using who don't have diabetes, now it's normalized the experience and actually kind of elevated people with diabetes to be, have this cool status because they're using these technologies to manage a condition, but also, biohack themselves. I recognize that we're not biohacking ourselves. We are actually using them to manage our diabetes well. But that perception is completely changed. If you're wearing a device on your body, it used to be weird, and now it's actually, kind of it's a status symbol, although that's not what it should be. That's what it feels like. And so the stigma has really decreased a lot in that process.
Yeah, I can't agree more. There's, I think, so much that we're still learning too, just about how the way that these newer technologies are, improving the lives of people with diabetes and helping with these things like stigma, and also with just like building community, with having a marker that, shows that someone has diabetes. I think it's really interesting, and I can't wait to continue to see kind of what the research shows there. And I think the other thing that I would add here is, to your point, Mark, I have been in the diabetes field a lot less time than Mark has. So take this with a grain of salt. But, when I first started working at DiaTribe about 5 years ago, stigma was something that we were starting to be working on and learn about and build kind of our own network within. And we were one of the only people that were kind of trying to better understand this. And we were looking to those few other researchers and healthcare professionals, people like Mark, people like the team over in Australia led by Jane Spate, or the team at the Behavioral Diabetes Institute, with Susan Guzman. And I think that we were looking at these other groups and we were saying, why isn't there more coordinated efforts? Why isn't there a larger umbrella of us kind of like working on this? And I would say, even in just the 5 years since that time, when you look at some of the major medical conferences, when you look at other leading diabetes organizations, I mean, Diabetes Canada this year, their entire campaign around World Diabetes Day is focused on addressing stigma, storytelling, and building more community, especially between type 1 and type 2. So like, that is something that if you had asked me 5 years ago, I would have said, no, that's never going to happen. Like, we're just going to be focused on prevention. We're going to be focused on complications. There's going to be still fear-based messaging. And we're starting to see that really come down and be replaced with more, I think, honest and frank conversations with people in the community about what they want to be talking about. I will say, I think an area where there's definitely still some room for improvement is the way that the media represents and talks about diabetes. We're starting to see some progress. For example, some of the characters that have diabetes in more recent media are definitely portrayed a lot better than some of those historical examples. But when we think about the sheer number of people living with diabetes, in our population today, that doesn't translate to how people are represented on screen with diabetes. And even just the kind of little daily actions that someone who might have, type 2 diabetes that's pretty well managed, maybe they, take metformin and, they check their glucose levels around lunchtime. Like, even those characters aren't represented on screen, let alone, those who have much more intensive management. And so I think like the reason why there's so much misunderstanding and so many misconceptions is because people aren't necessarily seeing it represented in an authentic and realistic way. And I would just really love to start seeing that, kind of across the board, not just in pop culture stuff, but also in how the media is talking about diabetes. And I mean, like the news media and kind of these things. The number of times that I hear stigmatizing language in a news segment around Ozempic is crazy. And so I think it's really important that, we are advocating for change, not just within the diabetes field, within the researchers or within healthcare professionals, but on the pop culture and on the more public facing side of things too. We've got to be advocating for more understanding, more knowledge, and better representation.
Yeah, that's something that every person with diabetes is definitely forcibly made aware of if we consume media. And I will say some of the worst offenders are in comedy, I think. And so it's nice that the Spoonful of Laughter campaign is doing comedy that's not stigmatizing. It's very rare that I'll see diabetes come up in anything related to comedy or trying to be funny, and it's not we're the butt of the joke. Yeah. But and I also want to say, I think since at least when I first became aware of like the diabetes community rhetoric, I think a lot of it at that time was focused on the cure. It was focused on we're not going to have diabetes in 5 years, like whatever number you want to throw out there. And I think now it's a lot more focused on just how to live our best lives now, which I really appreciate because yes, we want a cure, but in a way it's kind of, at least for me, it felt kind of dehumanizing in a bit to just be talking about the cure when it's like, well, unfortunately, I have it now though. It makes it feel a little bit like a sad story, like a tragedy, as opposed to, working with what we have. And I appreciate that the rhetoric has shifted a little bit since I have had diabetes in that direction. So it's hard not to internalize stigma and negativity. How can we reframe certain thoughts to make sure we're not accidentally making it harder on ourselves or perpetuating some defeating or inaccurate ideas about diabetes?
Yeah, that's a great question that I'll take on. So I don't mean to plug my book, but that's exactly what my book is about. So really, so I think that there are two parts of this here. The first is that we have to be honest with ourselves about the challenges that diabetes brings to us, as well as the challenges that stigma around diabetes brings to the diabetes community and us personally, and be very, very, very honest and realistic with ourselves about those challenges and really work to address them. But the other part of it is that I think that sometimes we take the challenges that we have around our own personal mental health as well as the stigma, and we allow them to become bigger than they are. And so by doing that, we're not doing ourselves any favors. We are actually making those challenges worse. And so it's a matter of having that balance of saying, yeah, I mean, again, back to the book, diabetes sucks, yes, and I can handle it. And really kind of seeing that those two things can sit in the same, can be there at the same time. Yes, I'm having a challenging day, but I'm still doing okay. Those things can exist, and really, taking a step back, because when we allow ourselves to, when we get fused with our emotions and our thoughts, how then everything spirals into a worst case scenario. And um, it's a matter of seeing the good with the bad. And I love Adam Brown's book, Bright Spots and Landmines. If you haven't read it, please do. But really, what he looks at is if you look at your CGM data or look at your blood glucose data for a day, what's the thing that sticks out to you? It's those big, spikes or those big or those lows, and that's what you look at when you're looking at 24-hour graph. But what we're not looking at are the times when everything was going well, because when everything's going well, it's you don't even pay attention to that. And so really focusing not only on the challenges, which we have to, or I shouldn't say focus on, recognize the challenges, but also focus on what's going really well for you in your life. And if you look, you can find it. And the more you look, the more you'll find them. And that really helps us reframe our mindset and our thoughts and our beliefs about ourselves, as well as the progress that we've made around with the issue of stigma. And because I think a lot of progress is made, and we have a lot more progress to make, but we need to recognize the wins that we have.
Yeah, I completely agree. And I think that there is such a important part of all of this, which is giving yourself grace to know that diabetes is going to suck. It's a complex, serious, demanding chronic condition that looks different for every individual. And so there are going to be unique challenges that are going to be hard to get through, that are going to, derail your day, or maybe take up time or take up mental and emotional energy. And that's okay. You're not alone. You're not the only person who's facing that. You're not even, even diabetes is not the only group of people who might be facing these types of challenges. And so I think giving yourself the grace to know that that is okay. It's okay to be down. It's okay to be frustrated, and know that, there are so many positives that you can lean into and focus on and use to help reframe, I think is really important. And a big part of this, I think, too, is just this idea that the way that stigma is effective in doing what it's set out to do is that it isolates people. It makes people feel alone. It makes people feel like they're the only ones who might be facing something. And so we've said it several times already today, but being able to create those connections with others, to tell your own story, to hear other people's stories within the diabetes community and outside of it, I think can just help to kind of make it so that stigma is not effective at making you feel alone, and it's not able to isolate you. You are not the only person who's having to deal with these things, and you're not the only person who has to figure out a way to succeed and move past them. And I think, when we're learning from others, when we are connecting with others in that way, there's so much more benefit. And it allows us to kind of, I think, all work on these things together. These challenges look a lot less scary when you know that there's 38 million people with diabetes that are working together on addressing them. And that doesn't even count all of the people who don't have diabetes who are trying to help out in the wings as well. So yeah, I would just say, lean on others, share your story, listen to other stories, and kind of do everything that you can to make sure that, you celebrate and focus on the high points, while giving yourself a lot of, I think, sympathy and grace whenever you are struggling.
Yeah, those are both really great points. I think being just the nature of the condition, being a person who has diabetes surrounded by people who don't, that is the norm. And we tend to internalize that and think that our blood sugars should be, just like that, whether consciously or subconsciously, we do think that. And so that's why I think we don't look at the stable ones as wins. We just look at them as, oh, okay, that's normal. But effectively, you're not normal. You have a different condition, you have a different daily life. And so that is actually a win for you, even if it's not a win for someone else. And I also want to say, I think perfectionism is something that really plagues the diabetes community. It's not our fault, but it's hard when you have so much information and you have that graph. And it's like, the way that we look at graphs it's kind of weird to look at a graph and be like, that's actually what's going on inside my body, and I'm doing it casually on my phone like this and not inside of a doctor's office. I think perfectionism can often be the enemy of progress. And I actually know someone who has a pump and had a CGM but got rid of the CGM because he was like, I can't look at all that data, like it stresses me out. And I understand the mentality behind that, because we really just have like so much information, and we didn't maybe 10, 20 years ago, that gives us the illusion that we can control all these data points. But we can't. And so that's I think a learning curve that every person with diabetes ends up going through. And hopefully actually with your book, Mark, people can come to the end of the learning curve a little bit more quickly. What was the title
Yeah.
of?
It's diabetes sucks and you can handle it. I think
Oh
it's,
yes,
um,
we'll plug that later.
I want to say something about perfectionism. So first of all, I love I mean, for some people, I really highly encourage them to either take their CGM off at least for a time. I mean, not forever, but certainly for a time if it's causing too much stress and anxiety because the data overload is real. And also, if possible, to be able to use your CGM in the way that it was designed, which is actually not to be looking at it all the time. It's to allow it to do its job and allow the alerts to let you know when there's something needs to be addressed. But at the same time, I think I'm not sure if this is a stigma, if this is specifically a stigma issue, but time and range, there's a big flaw with the idea of time and range. And that is that unfortunately in the US and I'm assuming other countries, the immediate assumption when talking about time and range is comparing it to a grade in school. And and if we're telling people that and we are that we want them to have a 70 that we want your time in range to be 70% or above, which is a good clinical guideline. Um, and they say, well, I don't want to get a C in diabetes. I want to get an A. The reality is, though, is that 90% of the time in range for most people is unrealistic on more, longer than a couple of days in a row, unless you stay home at your house and don't move and only eat salad. And that's not how we want to live. So we need to find a way to reframe and educate people about what time and range means and what the expectations are, and disassociate the idea of a grade or the percentage in a grade from what we want to see, because that just causes more stress, causes people to feel I'm not doing good enough and I am a failure here, which then just perpetuates the mental health challenges that they have. So I'm by no means advocating for getting rid of time and range, but we need to take a step back and say, how do we frame it in a way that is actually more empowering to people and not putting them in a position where they feel that they have to be perfect in a way that's only setting them up for failure.
Yep.
That's a great point. I didn't even consider it like that, but now that you're saying it, I view it like that too. Like when I look at the number, I'm like, oh, it could have been higher because I'm so wired to think about it as a school grade. Yeah, so thank you for pointing that out.
Yeah.
That was all the questions we have for today. I just want to give a quick shout out to Deepak friend Mallory, who I believe is celebrating her 31st anniversary today and is on this call. Congratulations, and thank you, Mallory, for advocating. And thank you to so much for joining us. This was a great call. I think we had some really good insights, and hopefully we work together to fight stigma in the diabetes community forevermore.
Definitely.
Thank you.
Bye bye. Thank you all.
Bye.
Yeah.